people tend to trust people in their immediate circle. So, whether they are teachers or their doctors or their peers and so on. And so having some sort of more, tailored types of policies where people who are in a position of trust actually help others understand, what is misinformation and where to find reliable sources and so on. That could be helpful.
So there's a lot of focus right now on the ways in which information spread through social media is negatively impacting people's health behaviors and making them more susceptible to COVID. But I think, the opposite is true too. It could be that, if people trust the information that they're getting from friends and family on sites like Facebook or Twitter, then if they're getting, information about engaging in positive health protective behaviors, we might see higher levels of compliance as well. I think in times of public health crisis, people turn to social media for information about what's happening, what they can be doing to protect themselves and protect their friends and family. And so that state of panic and that drive to gather information quickly is a ripe environment for misinformation to emerge and flow quickly. There's potentially an association between a belief that 5G is in some way responsible for the spread of COVID and institutional distrust, right? So I think that particular piece of misinformation is more endemic and broader distrust of government, of medical institutions.
It's a good practice to check where information is coming from. I know it's not easy on the internet, but if information is coming from some reputable news organization and so on, it's more likely to be reliable. There are a number of websites that fact check all sorts of information. The WHO has a Mythbusters, COVID Mythbusters website where they list and keep an updated list of common, COVID misinformation type of narratives, so people can actually go and check.
When you engage with external resources to try and better understand something as complicated as COVID or vaccination, unless you are a trained researcher in that area, you to some extent have to trust the experts. And so it's important to sort of distinguish between what is a valid source of what kind of sometimes has to be secondhand information versus what is not.